So for background to this audience, the standard of care for many patients with stage 1B to 3A non-small cell lung cancer has not changed for many years. We've made significant progress in the treatment options we have for advanced non-small cell with targeted treatment, and more recently, the immune checkpoint inhibitors. For patients with early stage disease, there was recent data looking at targeted therapy with the EGFR TKIs for patients with resected EGFR mutated non-small cell lung cancer. But for the vast majority of patients with resected non-small cell lung cancer, the standard of care has not changed for over 15 years and remains up to 4 cycles of cisplatin-based chemotherapy. That was based on multiple trials, which, when looked together in a meta-analysis, showed that adjuvant chemotherapy could reduce the risk of disease recurrence or death by 16%. In other words, a disease-free survival hazard ratio of 0.84 for patients with completely resected non-small cell. IMpower010 is a global phase 3 study looking at atezolizumab after adjuvant chemotherapy versus best supportive care for patients who had already had a complete resection. Next slide. This is the study schema, and as you can see, patients with stage 1B to 3A resected disease were enrolled. They received chemotherapy. 1,280 patients were enrolled and received chemotherapy. Those who were still eligible and interested in continuing after the chemotherapy were randomized 1-to-1 to receive atezolizumab at 1,200 milligrams, which is standard dosing every 3 weeks for 16 cycles, or best supportive care. Just over 1,000 patients were randomized. You can see here that we had a hierarchical testing for the endpoints. The first endpoint was to look at the disease-free survival in patients with resected stage 2 to 3A non-small cell lung cancer whose tumors had PD-L1 expression. When that endpoint was made, we then could look at all patients with stage 2 to 3A disease for disease-free survival. If that endpoint was met, we would then move on to look at disease-free survival in the intention to treat population. The color coding here is showing that in green, we have the 2 endpoints that we will be reporting on today or at the meeting that have been completed, and the others where we are still gathering information. Next slide. So this is the take-home slide from this presentation. This is looking at the disease-free survival curves with atezolizumab versus best supportive care after surgery and chemotherapy. And this slide is showing that the atezolizumab reduced the risk of disease recurrence or death by 34% in people with resected stage 2 to 3A disease whose tumors had at least 1% expression of PD-L1. In other words, the disease-free survival hazard ratio was 0.66, and this was statistically significant. We had a median follow-up at this time of 32.8 months. Next slide. Some of the other endpoints. On the left, this is the disease-free survival curve for all patients with stage 2 to 3A disease who were randomized. Here, the reduction in disease recurrence or death is 21%. In other words, a disease-free survival hazard ratio of 0.79. This was statistically significant. We then went on to look in patients with stage 1B to 3A. Of note, only 12% of patients on this trial had stage 1B disease. Patients with stage 1B disease tend to do better, and we require longer time to see some of the disease recurrence outcomes. At this time, we have not crossed the significance boundary, and therefore this is preliminary, and you can see this curve here. The overall survival data are not yet mature and have not been formally tested at this time. Next slide. This is the safety profile. These were all patients who had had surgery and had undergone chemotherapy. And therefore, when we look at all grade adverse events, they were seen in over 70% of patients on best supportive care and 93% of those receiving atezolizumab. Looking at the more significant or grade 3 to 4 adverse events, this occurred in 21.8% of patients on atezolizumab versus 11% on best supportive care. We had to stop treatment with atezolizumab in 18% of patients because of toxicity. Next slide. Next slide, please.
Just a moment.
Well, the next slide's a conclusion, so I'll just speak to that. So Empower 010 is the first global phase 3 trial using an immune checkpoint inhibitor to show a disease-free survival outcome in early stage non-small cell lung cancer. In this trial, patients received atezolizumab versus best supportive care after complete resection of stage 1B to 3A non-small cell lung cancer. It is important to emphasize that patients need screening to detect lung cancer early when it is potentially curable. We are now recommending to do biomarker testing for those patients who have had resected disease to look for EGFR mutations, which can be treated with EGFR TKIs, and also at some point to check for PD-L1 as well, because in this trial, the vast majority of benefit seemed to be in those patients who did have expression of PD-L1 on their tumors. The planned analysis for disease-free survival and overall survival and the intention to treat populations will continue with longer-term follow-up. Thank you.